These are recorded, so you can ask questions in the Q&A at the bottom of the screen. Please ask questions. You can ask anonymously if it would be helpful for us to understand if you're a partner, if you're struggling with the addiction, how long since discovery, whatever, some little parameters to better answer the question, great. But he always shares some topics and practical solutions. I have shared your webinar with so many people, even though I used to do these with Jon, and then I haven't, my colleague Scott has been doing it, but I still go watch the Rockin' Relationships because, I still remember the one on negotiation, and, you're like, if the area that you're willing to negotiate is, really tiny, it's, then it's challenging to make it, work. So anyway, lots of practical stuff. I'm going to shut up, let you introduce yourself, and let's get started.
Thanks. I'm Jon Taylor. As I'm looking at the attendee list, I'm recognizing some names. So for those of you that don't know me, I'm a clinical social worker, and I have a practice near Salt Lake City, Utah, where it started out, I was pretty primarily focused on addicts, sex and porn addicts, helping them early in recovery. I do a lot of relationship work now. And I'm finding a lot of fulfillment and excitement there. So I'm taking things that not just that I'm learning from trainings, but that I'm learning from the couples in recovery that I'm working with, and bringing that here so that you guys can benefit from what I'm learning from as well. And you can, hopefully take some of these principles and these insights and fold them into making your relationships better. And it's not just limited to your romantic or committed relationships. These are relationship principles, which means they apply across the board. This will help with relationships at work, relationships with your children, siblings, friends, any relationship that's important to you. So I think this is our third or fourth in a series that I'm going to do for as long as I keep finding content for it, on thinking errors and how those impact us in our relationships. If you've read any of Stan Tatkin's work, he talks a lot about this, how when it comes to our relationships, we can't trust our own brains, we can't trust our own narratives, because there's a lot of distortion that happens in our cognitive brains. Where it's all at is in what we've observed behaviorally and what's going on emotionally for us. So this series on thinking errors, it's slicing thinner that idea that our narratives always lie. And that's not because we're liars, but it's because by definition, when you put words around something, there are some things that translate well into words and there's other things that don't. So by lie, I mean they're incomplete. Narrative, the story we tell ourselves, will never get at the whole truth. So today we're going to talk about confirmation bias. This is I don't know that I would call it a thinking error. It's more of a feature that turns out to be a bug when we apply it to relationships. So backing up and giving a little bit of neurological context here, your brain is, it's the most energy intensive organ you have in your body. In fact, just one structure in your brain, the one that is mainly responsible for decision making, it utilizes 60% of the glucose that your brain gets every day. And that's a finite amount. And most of the glucose in your body goes to keeping the cells in your brain functional. So the brain is highly energy intensive. So what that means is that we've evolved to take shortcuts. We've evolved to recognize patterns. We've evolved to use heuristics or ways of seeing the world that are based on our previous experience. Because if you had to start over fresh every day with your perspective, you probably wouldn't make it to breakfast before your brain melted out of your ears. Just think about how many things you have on autopilot before breakfast. So what confirmation bias is, it's a form of that autopilot. It's a form of that pattern recognition that, again, individually is really good for us. It makes life easier. In relationships, it makes things sticky because people are always changing. and people are inconsistent. So what confirmation bias means is that we have a tendency to see what we think we will see. Where we see this applied most is in clinical research. So the gold standard of clinical research is a double-blind study. And that means that the researcher and the person that's being researched don't know what research condition they're in. They don't know if they're receiving treatment or not. Because as much as we might try, we will take our biases into every situation that we're in. So say, for example, I don't know, I'll just pull an example out of a hat. Say that you're working on developing a treatment for a new disease that is ravaging the world. And you as this scientist really want your medicine to work because, you know, you want to help life get back to normal. So if you're running a trial to see if this is safe for people, and you're really hoping that it's going to work, you're probably less likely to see concerns that you should have. And you're probably more likely to see benefits that aren't really due to the medication. We all have a tendency to do this. So essentially what happens is we, when we're in confirmation bias, we tend to wrongly ascribe data to support our existing narrative. Now, for couples in recovery, there comes a point where I think it's all about challenging the existing narrative. Because if you remember, our brains are pattern recognizers, and we interact more based on history than we do the present moment. It's an energy conservation thing. So there comes a point in recovery where we really are on a different foot than we've ever been before. I don't know about all of you, but when I was early in recovery, I was not on my best foot. I was not my best person. And I'm really, really glad that the people who are in my life now either didn't know me when I was early in recovery, or that when they did know me, that I was early in recovery, they were open to me continuing to change, that they didn't have that bias locked in. This goes both ways. Both addicts and spouses will create narratives to comfort themselves, because that's what narrative is for. It's to take a situation that's out of our hands, that's scary, that's big and complicated, and it's to put it within a story that makes sense to us. It doesn't matter the narrative that you have or the reason why you create it. You will always ignore fact. You will always ignore truth and data in favor of a narrative. Because again, think about neurologically, when we're uncomfortable, most of us will not neurologically say, well, this discomfort is part of the truth of this situation, and I've just got to, I've got to bear with it. We'll say, I want to get comfortable. So we make up a narrative that then becomes how we see our partner, whether you're an addict in recovery or you're the spouse of an addict, and you're trying to figure out who this person actually is. We have a big tendency to take the data from early recovery and apply that forward. So some examples of how these theories may come up and obscure what we're seeing in our relationship is he or she really doesn't want this. I know early in recovery, I had to think long and hard whether I actually wanted what recovery had to bring me, because it was so hard and so uncomfortable. So yeah, there were days that I didn't want it, but that changed at some point. He or she is punishing me. That's not to say that that doesn't happen, but think about how you'll view behavior like your partner saying to you, this is really heated. I'm out of my window of tolerance. I need to go regulate and calm down. I'm calling time out, and that's not negotiable. And so I'm leaving, I'm going for a walk. If our bias is my partner punishes me with distance, we won't see that as a move for healthy boundaries or a move to self-regulate before we try to co-regulate. We'll see that as, there you go again. You're leaving me because you're upset. He or she is a bad person. I don't really love the labels good or bad, because I think they're way too reductive. But I will say there were definitely times in active addiction and early recovery that I would have said about myself, I'm a bad person. I did not behave rightly or safely with other people. But notice when we carry that forward into somebody's really messy change process and they get it wrong, or their effort really doesn't hit the mark, and they're confused. Just think about, if you were to get a speeding ticket in a school zone, which was where my first speeding ticket came from when I was a teenager. If you were to get a speeding ticket in a school zone and you were subjected to a public trial because you're an awful person who doesn't care about children, you're a bad person. Well, I know that wasn't the case for me. I was careless, certainly, but wanting to endanger people and doing that for the sake of, malice, that's just not the truth. But if we have that preconceived notion, if we have that confirmation bias, you could probably find evidence in people's behavior that would support that, because none of us are all good or all bad. He or she wants to trick and hurt me. Boundaries, I think, later on in recovery really play out in this. Why is my spouse so upset with me and saying that, I need to leave the home after a relapse? Why else would they do that unless they wanted to hurt me? Oh, it may be more about I'm not wanting to be hurt myself, or I know that after a relapse, I'm not in a good position to be counted on to care for you or myself. So I'm removing you from the situation, removing myself from the situation so I can just focus on me. He or she doesn't try, or they don't want to try. All of these are possible. They're possible explanations, but when we notice with each of these, it's a narrative, not an observable fact. How can you gauge effort based on, or intention based on somebody's behavior? You really can't, because I know all the time it's really easy to fall in behavior that's easy, reflexive, that actually doesn't match my overall intention for the moment. So confirmation bias has us focusing on a story about intention and about who a person is, rather than what is it that I'm actually seeing. To me, as a therapist who's worked with people on these issues for just about a decade now, change is really sacred space. And with all things sacred, there's messiness and contradiction in it. That doesn't mean you have to be okay with that. In fact, the minute I find a cleaner change process that has less contradiction and less hurt in it, I will offer that to the world, because I think that would be a more palatable option, but it's not our option right now. So some things that you can do to check yourself on your confirmation bias, again, your tendency to see what you think you're going to see, is first of all, stay focused on deliverables. What is the actual behavior? I was working with a couple earlier this morning where we worked on this very thing. They have a check-in plan and a check-in structure, and he fell outside of that. He didn't hit his mark, as I put it. And one of the things I worked with them on is the feedback here is, you didn't get back to me when you said you would get back to me. To take that further and to say that means that you feel this way about me, or you don't want this or don't want that, that may not be quite the territory we're in yet. The truth is, we don't know why that happened yet. We just know that it happened. So when we focus on deliverables and behavior, we really check ourselves from making a theory about what that means. And we're just saying, hey, I'm noticing you didn't show up for our check-in when you said you would. What's up with that, is basically what we're saying. If you have a theory that you aren't willing to check out with your partner, ask yourself, why is that? So the day that I'm gathering tells me that you don't care, that you don't want this, but I'm not talking to you about that. Why not? That may be that there's a safety issue in the relationship. And for me to give you feedback makes you unpredictable. You don't stay regulated. That's dangerous for me. That's an important truth to get to. And that's not even about whether or not this theory is true. That's about what's the relationship that I'm in. So asking yourself, if I'm not making this internal, external, why not? It may help you refocus on what is relevant, what is more relevant right now. And the third piece of advice I'd have is prepare yourself for what it might feel like if there isn't a narrative to explain what's happening right now, if there isn't a true narrative to explain what's happening right now. So much of where I find myself with couples and even just individually, both addicts and partners, is needing to say something like, we just don't know what's going on yet. We need to gather more information. You're going to need to wait. And I know as I'm saying that, what I'm saying is completely unfair and not helpful for the feelings of distress and pain. I also don't think it's helpful for me to throw out a theory or to throw out an explanation that's not true, because later on down the road, we're going to have to change that. So you might want to look at, if I don't have an explanation, if I don't have a narrative that is comforting and, you know, catches all of the hard points right now, what is that going to feel like for me? And you might want to start exploring that. If that feeling is overwhelming or something that you don't know if you can handle, it might be a good idea to talk to your therapist or your sponsor about what's coming up, and work on preparing yourself for some of those feelings. That doesn't mean that it's going to happen that way. But I find that it's a lot easier for me to be connected with truth and reality when the overall feeling I have is, no matter what happens, I'm going to be okay. No matter what happens, I'll figure out what I need to do with this, even if I don't know that right now. That's an emotional capacity that I don't see a lot of the addicts that I work with. They don't have that, because addicts are not known for being healthy and resilient. They're known for being, I'll say, creative, destructively creative, to get to their resiliency. And for a lot of spouses, the rug has so thoroughly been ripped out from under their feet that to be in a place of grounded resiliency, I don't think it's fair to expect that early in recovery. We're working on getting the feet back under the body and getting some firm grounding again. So that thought experiment of what might come up for me if I don't have a story to explain this right now, it might help you focus on panic. It might help you focus on anxiety. It might help you focus on that feeling of, I'm not going to be okay if XYZ. I think the truth for the vast majority of people is there are very few situations that you couldn't end up okay in. You couldn't end up safe and grounded in. We just have to find our way there. So that is confirmation bias. And on that last point, I would say that's the reason why I want to talk about it, is because I think it really robs us of being able to prepare for life as it is, to be able to take life in reality. It keeps us kind of distanced a bit from what's going on in front of us.
I was thinking about that last point, and that is a really challenging one, because, I'm thinking, okay, you have to be okay with being in the in between of not knowing why, knowing things aren't right, but not having the answer. But how dangerous it can be to just go to the first one and then have that, oh, not that and not that. So then, it would feel like a series of continuation of lies, or I don't know, lack of safety, because, well, that wasn't it. So how am I ever going to know what the real one is? So,
Yeah.
but just, like you said, our brain goes to, I want to have an answer. I want to make sense of this. I forgot what I was thinking about the other day, but, like in hindsight, I looked at that and went, I know why. I mean, I can't even remember what the topic was, but it was like one of those things where my brain made sense of something, but it did it the wrong way. It wasn't true, but like that was well, of course I went to that because, and I could analyze it in hindsight, but, in the moment, just like you're talking about with, our brain looks for patterns. So you're looking for, how does this all make sense to me, even if it isn't. One of the things you talked about was the like not trying, but look at the behavior. But I often get this from partners, like a lot of partners who say, I don't think he's trying, and then they list the behaviors that in my opinion, what they're sharing is, it would not look like he's trying or trying real hard. Now
Yeah.
to him it may be like, I'm just like, I feel like I'm killing myself trying. So can you speak to that, about how do we look at, because maybe both are true, I don't know.
Trying, I would say, is really an issue of capacity. So I remember in my old house, our driveway was sloped towards the garage just a little bit. And we had a car with an unreliable battery.
Oh.
And so, we would try to remember to park it in backwards so that if it needed a jump, we could access the battery easily. Well, that didn't happen often. And I remember one day I was out there trying to push the car out of the driveway and I couldn't get it to move an inch. And the slope wasn't that bad. It's not like you wouldn't even notice it was a slope. And my neighbor comes over and he's this old wiry dude that's been a car mechanic forever. And, I kid you not, it was almost like he put one finger on the car and he just pushed it out in the road.
Mhm.
And I felt pathetic. And he was kind in that moment, and he said, I've been pushing cars my whole life. He said, I'm just ready for it. You weren't. um, so when I think of trying, it's a matter of capacity. The truth is, I think for the addict, maybe he is killing himself or she's killing herself to do what she's doing. The truth for the spouse is, what you're doing is not hitting the mark for me. This isn't what I need. Um, and I don't think there's any criticism in that. I don't think there's any judgment in that. I think actually when spouses can say that, they're focused exactly where they need to be, which is on themselves. And am I getting from this relationship what I need in order to feel safe? Where couples get off is they have an argument of whether the person's trying or not. It's actually not the issue. Again, this couple I worked with earlier this morning, it was big for him to be able to say, so I feel like in this year I have been moving mountains, but I thought that I was working on, I live near the Wasatch Range. It's a big range. He said, I thought I needed to move the Wasatch. I need to move the Himalayas.
Mhm.
And I said, you're getting it.
Mhm.
Um, you are putting in effort. It's nowhere near what your spouse needs right now to feel safe. And, we could either make that about, do you really want this? And maybe there's something to look at there, or we could look at, do you have the capacity to do everything your spouse needs to right now? And for the majority of the men that I work with, especially in the first couple of years of recovery, the answer is no. They don't have the capacity to do what their spouse needs right now. And that's where, programs like Seeking Integrity, work with a qualified therapist. I've had it ringing in my head since 2 weeks ago, Tammy, when you said that one of your fellows at Seeking Integrity says, tell the truth and tell it faster. That's a capacity thing. That's not just truth's a good idea. I've always been capable of telling the truth and I've always been capable of doing it fast. I just need to do that. No, it's a skill, it's an ability that has to be built. Um, so that's how I'd answer that one, is that it's perfectly truthful and perfectly okay to say what you're capable of doing right now is not what I need. I need you to keep developing. And if I had it my way, you would develop much faster than you're developing. I think that's perfectly fair.
I wrote down, when you're talking about the glucose and everything. I know for myself, decision fatigue. It's like there are moments when I go, like I am maxed out. I can't. I was sorting through Christmas ornaments and stuff like that, and I went, I can't do one more, because like I just, like I was starting to look at these ornaments, like, are they in the keep or are they in the give? And I'm sitting there looking at them and I'm like, and my brain is doing, well, if this one could have emotional connection because of this, but it really, I mean, like, it was ridiculous. And I just went, if you close the box and come back to this when you're fresh, you can do it again. So I do think that there's a lot of timing. Like, there are certain tasks that I need to conquer when I'm fresher and have more ability to do it. I was also cracking up with the glucose, because first thing I thought of is, well, no wonder, like, when I'm struggling, I'm reaching for, I would, or I really want to reach for something sugary, because
Yeah.
I thought, well, that's how I would get the automatic glucose, and then my brain would be addict. Then my brain would be better able to handle whatever, so it's just fascinating, all the way around. But I do think, having the capacity and recognizing our limitations, but knowing that if my limitation is now, I can't decide between those ornaments. That doesn't mean I never decide. It means I come back to it, when I have the capacity to do that. So
Yep.
we've got some questions. I'm a partner of an SA, married 38 years. I'm struggling to believe that this is a disease and not just bad behavior. Can you help me understand this? Thank you.
Well, first of all, I would say, just because what your spouse is doing may fit under diagnostic criteria for an addiction, it doesn't mean that it's an addiction, it could be bad behavior. I think it takes really careful assessment, and I think it takes some time to unfold what's actually going on here. I have worked with people who, from my perspective and the fact that they're losing their family, they are out of control sexually. But to me, one of the biggest indicators of whether or not this is addiction or whether or not it's bad behavior is whether or not the individual feels themselves out of control. Um, so, so some things to look at is, and this really highlights one of the things that I'm learning about couples right now, is that at the end of the day, it's behavior that matters. I need you to protect our relationship. I need you to be faithful to me. And there's specific behaviors that go along with that. It's not just thought patterns. It's, I've actually heard spouses say before, well, you can think that all you want, but I need you to do it. Some things to consider between disease and bad behavior. When it's addiction, there's usually some underlying neurological need. In other words, most of the addicts that I work with, their sexual behavior really isn't about the sex. It's not really about the relationship. It's about regulation. If you think about it, if you're prone to migraines and you feel one coming on, you're probably not going to take a baby aspirin and hope that that's going to be okay. You're probably going to hit it hard if you know that that's where it goes. With the addicts that I work with, unconsciously, that's kind of where they've been primed. My pain comes up, my discomfort, my dysregulation comes up, and I've never been able to experience relief on this. So I'm going to hit it hard. I'm going to hit it with something that totally numbs me out, transports me, takes me out of this. And there's a couple different ways of looking at it. One is the disease model, which is, the structures in the brain and the way that the body works are actually, they're dysfunctional. They're not working as designed or not working in concert. There's also the learning disorder model of addiction, which I think is really fascinating, and it carries a lot of implications here. So in addiction, it's a learning disorder where punishment does not register as punishment. Punishment is a huge way that we learn. I don't think it's the best way to learn, but certainly if we need to learn a hard lesson and there's punishment attached to not getting it right, we will pay attention and we'll learn. In addiction, punishment is often transformed into, I just didn't get it right this time, I got to try it again. You think of problematic gamblers who are playing the slot machines and, oh, so close on that one. That's not actually how slot machines work. Every spin is completely random and detached from the last one. So in addiction, it's that inability for the brain to connect consequence with behavior and to turn that into meaningful learning. And that does have to do with some difficulties in what's the word I'm looking for? Connectedness in the brain, integration in the brain. There can be some brain structures that play a role. There also are some people out there, and I would say I've in my work, I've far more often run into people where it is an addiction issue and not bad behavior, not careless behavior. But there are some people where sex is about power and it's about control, and they're not bothered by it. You are, and that's there's a difference. So I would make sure that you and your partner are getting good help that includes really thorough assessment. The people at Seeking Integrity and like-minded people, that's a big part of what we're all about, is before diving in and saying we're going to solve this problem, it's making sure we know exactly what the problem is, and that it is something that's solvable. But that could be helpful for you to explore, and maybe even read a little bit about, is what is addiction exactly, not as an apology for your spouse's behavior, but more as if this is what we're dealing with. I think there are some paradigm shifts that we have to make, or that we can make, that make recovery from addiction a little more possible.
And I ditto what you're saying, because I often say it's not an excuse, but it is a reason. And so it doesn't give an addict a pass on everything. But often there's also some other telltale signs. So like when I'm talking to people, I'll say, sometimes some compulsivity around shopping or gaming or eating or and you start and they're nodding their heads of like and so it rarely in my experience is all just one particular thing. I mean, people, smoking, vaping, cannabis, drinking, there's often something else. And if I don't have access to this to numb out, to escape, I will use that because that will at least do the trick in the moment. And so
Right.
so if you look at over the 38 years you've been married, are there other things that have been problematic? Sometimes people are 50 pounds overweight or I mean, and, so the food is serving a purpose from that standpoint. So so but I do understand it's such a betrayal and it hurts so bad, and it feels like he chose that over me. um and and yes, on some level, but Kim Buck, who's now Dr. Kim Buck, as of yesterday, she defended her dissertation, but she
Mhm.
mentioned in a webinar, and I think we've talked about it too. It's like, addiction is in this part of the brain where it's like breathing, where, like we defend our ability to act out regardless of the consequences, regardless of who we hurt, which goes to the dissociation and the compartmentalization. And so it's complicated and it's challenging. Ultimately, John and I believe that there's help and healing. There's opportunities for people even who have been married 38 years, to do things differently. So I hope he gets qualified help, and I'm glad you're here. And please join, the various partner support resources on this platform as well. So next question. SA here. My question isn't related to coupleship, but rather what I've been feeling lately. I'm 80 days from D-Day and have even fewer days since realizing I'm an SA. How common is it for addicts to feel anxiety and fear and pending doom after D-Day? These feelings can get pretty intense, and ironically, it looks like I'm totally fine on the outside, but there's a storm on the inside. So can appreciate this.
Oh, 100% common. Yeah. I would say if you're that close to D-Day and realizing that you're an SA and you don't feel panicked and that your future is full of doom, you're probably not in the game like you need to be. And that's not because the reality is that your future is full of doom and everything's going to fall apart. I think that's actually not what we're working toward in recovery. And the reason why we work toward not that in recovery is because it's possible to regain and reclaim a life that's even better than the one you thought you had before. But what happens with these recognitions, like when you're discovered or when you disclose, or when you realize I am out of control, is your concept of the world that you live in changes overnight. This is what we're talking about with these thinking errors. You had a story about what your life meant before, and now recognizing that you're out of control with sexual behavior, you couldn't stop if you wanted to, you've hurt your partner in a way that you can't repair, and there are no guarantees for your future. Of course you're going to be anxious. This is where early in recovery, opportunities to connect like this one and drop-in groups and 12-step groups and therapy, I think that's the biggest purpose they serve early on in recovery. I love it when I get to the point with clients where we can actually do the work, like let's look at your denial patterns, let's do this, let's do that. But before we can get there, there has to be this feeling of I've landed somewhere safe enough and help is on the way. And that's what getting into meetings early on is all about, is it's recognizing that you didn't have this figured out and couldn't do it on your own before, and you still don't have it figured out and aren't going to do it on your own now. So you need to get connected with really good support. That will help reduce some of the anxiety and the fear. It won't make it go away completely, but it will set you up to have people in your life that you can share that with, so that it's not just your burden alone. For most addicts in recovery, they went from living a life alone that they thought they could be in control of all their feelings to still living a life alone, but recognizing they have no control over their feelings. And the way that we learn to integrate and use our feelings is through interaction with other people. Um, so get connected as soon as possible if you're not. I'm guessing because you're in this room, you're working on that. Stay on that. Share in meetings how you feel. Talk to other people about what they remember from their first 100 days of sobriety. Take suggestions, be willing to try things out. You can certainly learn what to do about this, and you can get on more solid footing. But that's something you learn. That doesn't come from a story you tell yourself. It comes from abilities you can take to the bank, and that's what it's all about right now.
Yeah, thrilled you're here, and like I can so appreciate this. I've shared this before too, but like I numbed out all my emotions. I numbed out all my feelings, the good ones and the bad ones. And so when I was early in recovery, someone said, "Well, what are you feeling?" And I was like, "I don't know. I'm just feeling, and it's intense." And I hated it. And you know what? I survived it, and I've learned, and now I appreciate it. Like, even the negative feelings, I appreciate because it gives me perspective for feeling the good feelings as well. And I understand, that I need both of those. But what Jonathan was talking about with the being connected to other people, getting grounded by other people, when with those intense feelings, doing a brief little grounding exercise just in the moment. And what is your real reality? Your real reality is right now, right here. You're okay. You're okay. And feelings will pass, and there'll be another wave of intensity, and then like the storm inside, I can so appreciate that and understand that. But I also like, you don't have to have the mask on all the time.
Yep.
It's okay. It's okay to be real, with to go, I'm really struggling, I'm highly anxious, I'm like, it's okay. Like, that's how people connect with other people, is being real and not having the facade of, I'm all buttoned up perfect. And that's the
I'm
false illusion of addiction.
I'm not doing well is probably one of the most valuable things I've learned to say and to mean in my recovery, because that's what it's all about. If I'm putting on a mask on the outside that everything's fine, I'm just setting myself up to take care of myself in destructive ways, versus getting help. And it's not that when I started using that phrase that everyone I said it to knew what to do with that and could help me. A lot of people are like, why aren't you telling me that you're fine? Because that's just what I want to hear. um, but you try out that reality enough, and you'll find people and situations and abilities that can actually help you with, I'm not doing okay, and that's okay.
Yeah, I mean, I've shared on this. COVID has been challenging for me. There are moments when I have to ground myself and remember that eventually this too shall pass, and
Yep.
eventually, I mean, like, and I talk to people, and I have to share. In this moment, I'm not feeling so okay. Now I have some choices. What can I do? But like, yeah, I can't be, that would be an untruth for me to live in a facade like that. So,
Yep.
and that's not what recovery is. It's being real. Okay, next question. Is it possible for an essay? Is it possible that an essay does not understand why he did what he did, or is it a fear to face what he did to the spouse? The essay is just embracing recovery.
Uh,
That's good. He's embracing recovery. That's good.
yeah.
Okay.
Yeah, that's the first important step. I'd say the answer is yes to both questions, and they're probably, there's a series there. So the majority of people that I work with, if they were in their right mind, they wouldn't do what they did in addiction. It's like what we were talking about at the beginning with the Christian men's group. They're very far disconnected from their values, even if it's not a religious value. That's where the shame and the guilt comes from. Um, so because of that, when I'm working with a guy, I've gotten to the point where I think it's a little amusing when somebody comes into my office for the first time and says, "I'm a sex addict, and here's why." Like,
Oh, wow.
you don't know why you're a sex addict, because by definition you haven't been in touch with the why in your life. you've just been in touch with the, how am I going to get away from this? So it takes some time, and it takes some real neurological development, some real neurological ability to even start to grasp with what was going on for me when I did this. I remember the first time that I really embraced how lonely I was.
Hmm.
And that was probably a year into recovery. And I had all sorts of other theories about, what drove me. And I'm still discovering, some of the whys. Then the other part is to realize that what we did out of self-preservation, um, the impact that that has on another person that we thought we were protecting or that we wanted to protect, that's another big disconnect, and that's another big moment of shame. So most of the time when I'm working with guys individually, the recognition of what they've done to their partner, that comes way before they're willing and able to talk to their partner about it and own that. Because there's usually a lot of shame, there's a lot of overwhelm. There's that feeling of, well, now that I know that I've done this, can this person really accept me? Can they really still want me? And the irony of that is, what you've done and the impact on your partner isn't news to your partner. Your partner knows what the impact has been because they've been living it. So the irony of that is, yeah, they probably can still accept you. What they're waiting for, by and large, is, I need to know that you know, because number one, that affirms to me that you see me and that you get it. And number two, if you see me and you get it, and that stays up here in your mind, you're a lot less likely to do something like this to me again. Um, so yeah, I would say it's completely possible that both of those things happen. In fact, I think that's the rule, not the exception, that they don't know. And I work with my guys early on in recovery not to make promises about what you'll discover and when you'll know, and that you do know. You really have to embrace that this is an unfolding process of self-discovery. I'm 15 years in, and I'm still learning really crucial, valuable things about myself and how I work and why this and why that. And to me, recovery is about developing a functional relationship with yourself so that you can have a functional relationship with others. And I always say to my couples, you guys think you know each other really well and you don't have to work hard to keep up, but you're always going to have to work hard to keep up because you don't know each other as well as you think, and you never will be able to know each other to the point where you can afford to go on autopilot. And it's the same with ourselves. We will never get to a place where we understand ourselves so thoroughly and so completely that we get to stop investigating, that we get to stop wondering. And that's a functional relationship with the self.
Well, that was interesting because my husband and I just celebrated kind of a major anniversary, and I was like, "Oh, do I just think I know him?" Like, I'm when you were talking earlier, I was thinking, the continuing to be curious, and like it's a good reminder, be curious, and not just assume I know everything after all these years. But I get a lot of calls from partners too that they want to know why, because,
Yeah.
and I really do believe that if they, it's like if we can just figure out why my partner is this way, then we can figure it out and we can fix it. And like you were talking about, it's continuing to unfold. And there was something that happened a few years ago that like was another piece of the puzzle. I don't think I could have dealt with that earlier on. It didn't really come up to the surface, but it was it was another piece. And so just to be willing to be on a journey and understand that it's, we're not going to arrive, and it's not going to be, well, got that addiction thing all taken care of and it's in my rear view. It's not. It's but the gift of it is that as I continue to grow, I can be in a more meaningful place, with my relationship with myself, but also with all the people that are around me too. So it's worth doing the work. Scary that it can be at moments, um but I think some wise, it is important, to understand and address the traumas and whatever. But there are so many pieces, but it doesn't fix it to just understand why. You can't go read a book and go, oh, now I know,
I,
done.
I've got a guy that I've been working with for a couple years, and his initial treatment goal is I want to understand how my trauma is connected to my addiction. We accomplished that goal in about 3 months, and I think we really came up with the answer. Nothing changed for him,
Mm,
and we spent about a year and a half after that him trying to figure out why has nothing changed, and now he's coming around to, oh, it's not enough to just know why this is connected or know that this is connected. I have to do something about how I feel. I have to do something
yes.
about how I respond to this. Again, at the end of the day, when it comes to our relationships, behavior is really all that matters, because it's either the behavior that provides the safety and the security for us or the behavior that destroys it. Um, intention doesn't get us far, especially when the stakes are high. We need deliverables.
Yeah, well, and intention or words,
Mhm.
when someone is in active addiction and they've been lying for to themselves and everyone else for years, decades, just saying, "Oh, now you should trust me. Now I'm different." That's prove it. Let your
I,
actions show it.
I really like the phrase "earn it to own it." If you're going to own it, you better have behavior that backs it up for a long time.
I agree. So, other questions? We have a few minutes left. Anybody else have another question? Somebody posted, "Thank you for the insight and wisdom. I'm grasping for feelings or for the feelings and truth that comes with this too shall pass. It won't come overnight, but I'm trying to get there bit by bit." And that's exactly what it is. It is bit by bit. And to know that it's okay. It's okay to be uncomfortable. I was
Mhm.
loath to be uncomfortable. I mean, that's what numbing out is for. You don't have to feel that way, but to just know that I'm uncomfortable and I have support. I have things I can do. I can reach out to some other people. I can get out of myself.
Yep.
That's yeah. If I'm just sitting there feeling like I'm so uncomfortable. Oh, it's so terrible for me. If I pick up the phone and call somebody, that's a easy way to get out of me. So
Yeah.
this is a great question. How does ADHD impact sex addiction? And I'm going to in the chat. I'm going to put because Dr. Todd Love did a Super Saturday Recovery Summit a video on that and a podcast, and he talked about that. So
Oh,
I'll
he's
send you the
good with
link.
that.
And I'm also going to share that Jon Taylor is going to be doing the April Super Saturday Recovery Summit on In the Room. So both of those are going to be posted. So
Yeah. I'll give you a little soundbite on that because, in full disclosure, I'm not an expert on how ADHD and sex addiction go together. I have a rudimentary understanding. Todd's really your guy on that. He's got such a lock on that and understands that really well. Um, but one of the ways that may impact is, what I tend to see with my ADHD clients, especially if they're the hyperactive kind, and it's not just the attention deficit. Think about the drug, Ritalin. Ritalin's a stimulant. The impact that has on a hyperactive attention deficit person is it brings focus. Most of my ADHD clients, they have more extreme, more intense acting out behaviors. So one way of looking at that is it can be a self-medicating thing. I do this intense thing and it brings focus. It quiets down the chatter in my brain. Also, impulsivity comes along with ADHD. There's lower levels of prefrontal cortex integration with other parts of the brain, which is also kind of how it works in addiction. So ADHD folks tend to be more impulsive. They tend to be more prone to impulsivity, which is where addiction starts. Impulsivity and addiction are not the same thing, but you stay impulsive on something for long enough and it will change how your brain is wired around that, and it may move into something that's more addictive than compulsive. So this is a little preview. Definitely check out Todd's stuff. I'm sure he's
yes,
got a bunch more to say about that.
I about fell out of my chair when he was talking. Like I try to stay up on things, and he shared some things that were just like, I was like, wow, it really does matter, getting the right treatment for that. So, like I said, he did a podcast with Dr. Rob on sex, love, and addiction, but also on the Super Saturday Recovery Summit videos. There's a video, I put that in the chat. So, okay, next question. What about the initial decision my SA husband made to have sex with other women? He wasn't a sex addict yet when he did. That was years before he became addicted. Hmm.
I'm not sure where to go with that. I don't hear the question in that, and I'm not sure what the context is. If you could give us a little more context, I might be able to help with that. But I'm not sure what to answer there.
Yeah, yeah, like for me, I had an addictive personality before I ever picked up my first chemical. I mean, like in going back over things, the garden was ripe for becoming an addict because it was, I had all the
I'll,
all the stuff.
I will say this, kind of in reference to what you're saying, Tammy. Unlike alcohol, sex itself is not inherently addictive. So alcohol actually contains chemicals and compounds that do produce things like tolerance, withdrawal, all of that. Sex by itself is not that. So when somebody's addicted to sex, that comes out of an attachment disorder or an attachment rupture. In other words, there's a hole that needs to be filled, and sex is what I try to fill the hole with. You can't become addicted to sex by having a ton of it. In fact, probably the opposite will happen if you have tons and tons of sex and there's not anything else that's pushing you towards it. You'll probably, we call it satiation. You'll probably like, all right, that's a lot of sex. I'm done. I'm going to take a break for a while. So um, that's interesting to me. He wasn't a sex addict yet. In my experience, it doesn't form. It's like the table's set for that. And as soon as sex comes on the scene, we see the beginnings of addiction forming.
Yeah, Dr. Roberts talked about, he learned to dissociate it. His world wasn't safe at 4 years old. He
Yeah,
wasn't having sex, but he learned to dissociate in other ways. And then, then when he became sexual, then it was like I'm not telling tales. He's on webinars doing this, so I'm not telling tales. But so like you said, the table was set. So that would be a
yeah.
more clinical thing. So
So for example, with me, I know that alcoholism is in my family. My grandpa was an alcoholic. I have several uncles who are alcoholics. As far as becoming addicted to alcohol, I have never touched the stuff because I'm terrified about my genetic predisposition. I will never become an alcoholic if I don't drink alcohol. This gets into something we call this epigenetics, which is certain parts of our genetic suite, our brain structures, our biology that are not activated unless the environment calls for it. Sex is one of those things that I would say just about every human being on the planet is going to encounter at some point. So if you've got the table set for it, if you've got the predisposition, and you're in the right position to have a mind altering experience, a feeling transforming experience with sex, um, again, yeah, you don't become a sex addict later in life. When you start developing sexually, if you're a sex addict, that's where it starts to manifest. There is, like with pornography, we do see with the emergence of internet porn, what we'd call, I forget what they're calling it, but that is due to the proliferation of porn, and especially because internet porn it's designed to be more than your brain can handle. That you can become addicted to without the attachment predisposition. Um, I'll just say, differential diagnosis is really important here because it's not a one size fits all, and not every situation is the same.
So last question. I'm about a week from D-Day. I've been sober from alcohol for a little over 2 years now, so I've got tools to fight my addiction, and I'll begin to see a specialist next week. My question is, I'm a grad student, father, and I work full time. My job and education mean the world to me and are a big part of staying clean. How do I balance the many tools that will be thrown at me over the next few months, seeking out new outlets for addiction energy and still keep my head above water in school and work?
Um, oh, that's a really, really good question. When I was early to recovery, I was in just about the same situation. And where that went for me is I turned my school and work into my recovery. I became an addiction therapist. um, that's not to say that my education was my recovery, but I got to live and learn about those principles pretty much around the clock. Um, so I would say here, addiction recovery really is, it's kind of a full-time job. That doesn't mean that the way recovery is presented to you is the way that it's going to work for you. As with all tools, they're a pattern, and patterns have to be adjusted and altered to fit our bodies. It's like taking in a suit to be tailored. It's not that the manufacturer got it wrong. They gave you something general, and we make alterations to really make it, fit you perfectly. Um, so I would say making sure that the saying in AA goes, whatever you put before your recovery, you'll lose. So recognize it really is a choice you're making between the two. That doesn't mean that you have to drop one to pursue the other. Just make sure you don't displace your recovery. I'd say making sure that you have a weekly recovery meeting at least. Don't treat that like a meal you eat, you don't skip it. I would say really diving into and being fully present with school and work. The principles that make your recovery run are going to make you successful at work and school. So practice those principles in all areas of your life. If you're out of alignment with school, let's say that you're, over caffeinating to stay up and study, you're pushing limits there. That might be something that you want to consider as part of your recovery. If this is what it takes me to do this part of my life, is this really healthy the way that I'm pursuing this? So I think there's all sorts of ways that you can fold recovery into what you're doing right now. Just because recovery is a full-time job doesn't mean that it's the only thing that you can do and be interested in. Knowing what your bottom lines are, knowing the signs of trouble, and being committed to follow through and give yourself what you need when you're in trouble. You can do that as a full-time father, full-time employee, full-time student. It takes intentionality.
And I'm really on board with what you said. Anything I put above my recovery. But here's what I heard: two things. Fight my addiction. Like your addiction is your addiction. So fighting
Yeah.
it and being in a constant, just understand that
We're
it's a journey.
we're integrating, not eliminating. Your
Yes.
addiction actually has a lot of valuable insight as to why you work the way that you do and how you hurt. So we're not trying to keep it at bay. We are trying to stop acting out so we can get at the real feelings and the real truth.
And the other thing, my job and education mean the world to me. And I'm going, I would really work with somebody because I would have loved to see you say being a dad is my most important thing.
Yeah.
And then job and so in addiction, our priorities get out of whack. And I'm going to invite you to look at what you really need. I was in school, I had to take a step back. Um, and from that in the moment, it was all about timing. So we have to go. I have to go to another webinar. So John, it was great to see you. I will see all of you guys online in the future. Keep coming back. Thanks, everybody.
Thank you.
Bye.